Today we are here with Adam Cirlincione from Midtown Podiatry. We're going to be discussing neuromas. Dr. Cirlincione, can you tell us exactly what a neuroma is?
Sure. A neuroma is quite simply an inflammation, scarring, or enlargement of a nerve in the ball of the foot at the base of the toes. Typically it can be caused by tight shoes, and most often it's a result of a change in shape of foot. If a person's developing a hammer toe, bunion, the foot is widening, that change in shape of the foot can cause an irritation to the nerves that supply the front of the foot.
What are some treatment options for neuromas?
Well, they can be conservative and surgical. Most often doctors will start with conservative care, which is consistent of either an orthotic or an insole placed in the shoe to take pressure off of that nerve. Some patients will consider an oral therapy of anti-inflammatories, but most frequently doctors will consider injection therapy around the nerve, consisting of either a steroid and lidocaine type mixture or an alcohol solution that's used to treat neuromas. There are some newer treatments with cryotherapy, which is essentially a percutaneous or a puncture through the skin and the use of a cold temperature to try to treat the neuroma, and there's something called radiofrequency, which uses heat through the skin to treat the neuroma.
Are there any recovery times for that?
Those are pretty ambulatory procedures. Patient comes in, leaves the same day with perhaps a Band-Aid, not a long recovery. It may take a course of injections before a patient will see a significant relief. There are surgical treatments for neuromas, and those are reserved for patients that fail conservative care, where a doctor will either decide to release a ligament that surrounds that nerve or remove that neuroma or that portion of nerve if it remains painful and the patient's unable to get significant release with conservative care.
And what would the recovery time for something like that be?
Something like that is usually about 2 to 4 weeks, 2 weeks with stitches, walking around in a surgical shoe or a boot, and then a return to the sneakers or wide-fitting shoes.
Wonderful, thank you.
You're